Hello, and thank you so much for joining us today. My name is Andrea Willis, and I serve as Chief Medical Officer at BlueCross BlueShield of Tennessee. I am honored to host this panel to talk about COVID-19 vaccines on behalf of the Chattanooga Chamber. And we have with us today Dr. Mark Anderson, who is an infectious disease specialist at CHI Memorial. He has practiced in the infectious disease field for over 30 years, and 26 of those years have been in Chattanooga. We also have Dr. Adam Soufleris, who is also an infectious disease physician. He is with the infectious disease group, and you find him mainly at Park Ridge and Park Ridge East. And thanks to both of you for being here today. I want to take this time to applaud and appreciate each and every one of the frontline healthcare workers who have fought and continue to fight the courageous fight against COVID-19. I also want to thank all of the essential workers that kept showing up to meet our needs. I cheer all of those who have triumphed over COVID-19, and I wish nothing but comfort for those that have lost family members and friends to COVID-19. And that's why today's talk is so important, because we're talking about steps that can be taken to try to avoid losing any more people to this pandemic. Today, we're talking vaccines, and we're so fortunate to have infectious disease doctors here to have that conversation. So doctors, let's just start with what's in the news right now, and that's what's going on with the Johnson & Johnson vaccine. Can you talk about what's happened and how concerned should the public be?
Actually, I would say the public should be, well, I'm actually impressed with the ability to pick up very rare events. I think the public should see this as scrutinization of these vaccines. They've been released. In this country, 6.8 million people have received the vaccine, and they picked up 6 cases out of 6.8 million, a 1 in a million event. And this is a rare clotting complication. I think this is being looked at, and we will have Johnson & Johnson back in the United States once they scrutinize what are risk factors and how can we most safely use this vaccine. I think we also have to think, again, a 1 in a million event here. If you look at having an infection with COVID-19, the risk of clotting is about 16%. So we're talking, 0.0001% versus 16% when you look at these two things. And also clotting, there are several. I mean, if we look at risk with birth control pills, you could have 0.05 to 1.2% risk of clotting. Smokers have a risk of clotting. So I think it's something that we need to look at, and they're doing that. I think the Johnson & Johnson vaccine is still excellent and will be part of the armamentarium. And we'll just need to know what are some risk factors so we can avoid that group in the future.
Great, thank you. Dr. Anderson, did you want to add to that?
Yes, I mean, I agree with Dr. Soufleris. I am very reassured by this whole process, just as he said, that this is being scrutinized so carefully that we're picking up on things that are exceedingly rare. And honestly, we still actually don't know that this is due to the vaccine. There's a great concern that there is. That's why they put things on pause. But something so rare could just be chance. I mean, people are getting clots across America every day, just like how they presented in these vaccine recipients. And so we reach the time where lots of people, millions of people get the vaccine, and inevitably there will be some coincidences that might not be actually related. The statisticians have to look at that very, very carefully, and it's concern enough that we did put things on pause. That's what we want here in the public, to make sure that this is a safe vaccine. And again, I'm reassured by that, and I agree that I think that they're going to identify commonality between those people who got clots, so that we know who's at the highest risk of that rare complication, and we can screen people and say, okay, we won't give Johnson & Johnson to these people. We'll give the other vaccine. Everybody else is safe to get Johnson & Johnson. So I feel sure that's what the finding will be within the next 7 days, and we can get back on track.
That's great. And you make a great point. We know with the current headlines that people that are already hesitant, this probably just makes them a little more hesitant.
Right.
And you just pointed out something, some people will kind of apply this to all of the vaccines, but the vaccines are different. Can we talk about what's different with the Pfizer, Moderna versus the Johnson & Johnson?
Well, Pfizer and Moderna are completely different mechanism for delivering. Basically, with vaccines, we're delivering a signal into the body to tell our immune system to start making antibodies against a particular target. The Pfizer and Moderna use a technology called messenger RNA, which it's a part of our natural genetic work within all living beings. And so they use that to transport this signal in to prompt the immune system to make antibodies and stimulate other parts of the immune system to get ready to fight off infection with this virus. This technology has been studied for many years. These are the first 2 vaccines of that technology approved in America, but they have been used in studies in many other parts of the world in recent years. The technology was used for the Ebola vaccines, which are being used in parts of Africa now, where whenever that virus reappears, and we've had years of experience using that vaccine type there for Ebola, very, very safe, saving many, many lives and much suffering there using that same technology, and at the same time demonstrating how safe it is. Pfizer and Moderna vaccines, those vaccines, we have not seen any issues with clotting so far. They've been amazingly safe. Serious reactions to those are just vanishingly rare. People probably heard early on about people having anaphylaxis, people who kind of have a tendency towards that. So we can screen for that. And if anaphylaxis happens, that's actually easy to treat. You just got to do it right then and there. And at vaccine centers, we're prepared to do that. So again, those 2 vaccines, which are still readily available, we've not seen the same problems with them, are very, very safe. The Johnson & Johnson uses a virus to transport it in, an adenovirus, which is a benign, harmless organism to do that transport inside the body to signal it to start an immune response. So it's a different way of getting it in, and really a completely different technology.
Right. Okay. Well, Dr. Soufleris, I think because the side effects, especially, or what we're hearing in the news right now, we're talking about women between the ages of 18 to 48, I think that it was. So I know a lot of people are asking, should pregnant women be vaccinated?
Yeah, they do say that yes, pregnant women should be vaccinated, because pregnant women, if they do acquire COVID or SARS-CoV-2, get COVID-19, they have a worse course. More have to be hospitalized and often don't do well. The vaccine, again, we'd probably go with some of the others right now. Well, we actually only have 2 that are not on pause. But yes, those vaccines should be given to pregnant women, and they do say that's a discussion too with your obstetrician gynecologist and the patient. But from an infectious disease standpoint, very beneficial. And the other benefit is mom will pass on the antibodies to her child. So when they're at their youngest and can't fight off things, they'll have some resistance against the coronavirus.
Great, great.
Yeah, I mean, so far there have been no problems seen associated with pregnancy with the vaccines, but as Dr. Soufleris just said, a lot of problems when pregnant women get COVID. And I'll just add that my oldest daughter, one of the most precious things in the world to me, is now pregnant with my wife and I's third grandchild. And without hesitation, we advised her to get the vaccine, and she got it safely.
Great, and congratulations.
Thank you.
We have seen the case rate numbers go down for COVID, which is great. And we certainly want to see that vaccines are a part of that picture. But some people see the case rates going down and they say, well, I don't need to get vaccinated. Things are moving in the right direction. Why do I need a vaccine? What do you say to those people?
Unfortunately, even though the rates have gone down, and we're very happy with that, they began to go down before we had widespread vaccination. So there's probably other factors that go into that, but vaccines did play a role. But there's still a lot of it out there, and it seems to have really plateaued both across the United States and within our area. I believe yesterday it was something like 75,000 cases, and we were in the hundreds of thousands of cases per day in the United States in December and January. So it's gone down, but that's still a lot of cases, and a lot of cases locally. Certain states like Michigan, it's actually gone almost as high as the winter time. So people are still very much at risk unless they stay completely isolated from all contact with other people or observe the strictest of precautions with masks and distancing, et cetera. Those things do work, but the thing that protects you the most against getting a severe life-endangering case of COVID is the vaccination.
Okay.
And I think the other point too is, as everyone's heard, we have the variants, and the variants are of concern, especially the 117 variant initially seen in the UK, will make the virus more transmissible, or you're more infectious for a longer period of time. And there's concern with that we'll even see more spread. And I think you're right, Mark, everything has had plateaued, but I worry we're starting to get a little uptick, and certainly in certain states. As we let this virus circulate, and when it's within any one person, there's billions and trillions of viral particles, and that's what allows you to have mutations which become the variants. So again, for protection, as Dr. Anderson said, the best we can do is really to get vaccinated and try and prevent transmission and cut off the transmission between the human beings.
That totally makes sense. So you brought up the variants. Are these vaccines going to protect us against the variants, or are we looking at boosters?
Well, I think in a couple, right now, it looks like the vaccines are effective against the variants. And if there are certain, when you look at data, they talk about efficacy rates, et cetera. I think the important thing to know is that all the vaccines, all three of them, when you look at developing or what a vaccine should do, prevent you from getting sick, prevent you from ending up in the hospital, and prevent you from dying. And all of them are nearly 100% effective at preventing you from getting sick enough to be in the hospital and preventing death. So they're all very effective. The booster question is almost secondary, like how long will immunity last? I see this virus, we'd like to all say we're done with it, it's over. It's not going to go away for years. And we can do the best by trying to vaccinate everybody, And yes, very effective right now against the variants.
Great, thank you.
Yeah, I think we may well have to get boosters for this in the future, maybe as early as next fall. The faster we get the most people vaccinated now, the further out it will be that will likely have to happen or have to happen at all. As Dr. Soufleris just said, we got to get the amount of virus down in the human population so that these variants stop happening, and then the chances of needing further boosters in the future will go down, at least for changing virus. Whether our immune protection will last, how long it will last, we don't know that. We're still early on, but the signs are now that it will likely be quite long-lived, and we may not need a booster as far as boost our immune system without considering variants for maybe even several years.
Okay, thank you. Great information. And it's been stressed here that we want everybody to get vaccinated, but right now, children can't get vaccinated. So, are we just going to stress it in adults? What is the future for children as far as the vaccines go?
Now we plan to get those little rascals and jab them as well. The focus on all the studies to get vaccine approved were done in adults because it was evident pretty early on that most of the severe disease was in adults, and children didn't seem to get infected as easily and very extremely rarely got seriously ill, although that does happen. And they don't seem to be the ones who transmit it most of the time. That's very different from other viruses like cold viruses, influenza. Children are the ones who transmit those the most. But not the case with this virus. So we focused on adults. Our studies are being done right now in children, and to make sure that it's safe and that there's nothing unforeseen. Again, more evidence of how careful the people who are in charge of vaccination are to make sure this is safe for everyone. So they're doing separate studies with children. It's hoped that those will be done. It would be great if they could be done by the end of the summer, right before the school year, but we're just not sure if they'll be done that soon, but probably the fall at the latest. And right now there's no reason to think those trials won't go well, and at that time we'll start vaccinating children. But we won't do it until we know it's safe, just like we didn't start doing it in us adults until we knew it was safe.
Right, okay, sounds good. So we've talked about the children, we talked about pregnant women. People with chronic conditions sometimes are worried that getting a vaccine will exacerbate their condition or interact with the medications they take for their chronic conditions. What do we need to tell them?
Well, I think that that's as with other people we've talked about already, as with Dr. Soufleris said, with pregnant women, the risk of getting infected with COVID far exceeds the risk of getting the vaccination. People who are immune suppressed so far have not shown any increased risk of bad side effects or dangerous side effects from the vaccine. Our biggest worry with them is that they might not respond to the vaccine well enough because their immune system just can't respond as well. That's always been a problem in vaccinating people who are immune suppressed. But I'm much more worried about them getting COVID than I am any sort of risk from the vaccination. And I'm like most parents, I never pass up a chance to talk about my children. So another of my daughters is immune suppressed. She has rheumatoid arthritis. She's 25 and she's on a biologic and immune suppressing agent for that. And I wanted her to be vaccinated as well. She just got her second shot today.
Very good. Very good. Well, Dr. Soufleris, if somebody's had COVID, they have some immunity. Do they need to get the vaccine?
Well, they do have immunity, but getting the vaccine will boost that immunity, several-fold, many-fold, and that extra dose of vaccine will protect them for a long period of time. Interestingly, this virus is not one and done. You get the virus and you can't get it again. But if you're able to boost your immune response with a vaccine dose, that'll be very beneficial. And that dose of vaccine after an infection, again, will get you higher levels than even the vaccine alone. So it's recommended through the CDC that anyone who's had COVID-19 get vaccinated as well.
Okay. So if I've got my plan made up, I'm going to get my vaccine, and maybe I need a couple of other type immunizations. Can I just get them all on one day and just get it over with?
No, actually. I think the short answer there is no. We'll separate all the vaccines, and we're going to concentrate on COVID-19 now, and then we could work on the other vaccines down the road. So no, you just get your COVID-19.
Okay.
Yeah, we give other vaccines, and we vaccinate people, a couple or three at a time. In fact, I was in the Navy, and I got like 8 vaccines in one day. Boy, that was a lot of fun. But with a new vaccine like this, it's a general recommendation that you not take it with any other vaccines to ensure there's no questioning of any side effects that you have that they might, what it's due to. So.
Okay, great. And you just kind of mentioned something, and it's been alluded to earlier, a new vaccine. The thought of it being a new vaccine is what scares people, and they feel like the trials were rushed. What do you say to people about the trials? And I've even had some people say to me, well, it's not really approved at this point. How do we get people to not be confused on that point?
Well, I think with these, quote, new vaccines, number one, their development was predicated on work that's been going on over the last 10 to 15 years. And things, they certainly were able to move through and get this vaccine done, but it wasn't by cutting corners, it was by cutting red tape, mainly, and investing a lot of money. Instead of doing trials one after another, phase 1, phase 2, where you're testing and looking at dosages and then enrolling a big group, they did those parallel, and that cut out a lot of time. The trials that were done had, between the 2 RNA vaccines, 75,000 people. There were 40,000 and 35,000, and that was the numbers that you needed, and it was done for the long enough period of time. They did it 2 months, and it's interesting that with all vaccines throughout history, if there's ever side effects, you find them within the first 6 weeks. And there have been side effects, bad side effects, with many vaccines over the years, and you find those within the first 6 weeks. So they had enough people. They had it done for a long enough period of time. And then you continue to scrutinize as they've done. When we picked up these 6 cases of rare clotting, you continue to follow up sort of post-marketing time. And so although they did do things very quickly, again, it was money, investment, a lot of science, and the vaccines are just, I mean, no one would think you'd have an efficacy rate of 95%, but they hit it just right.
And as Dr. Soufleris said, the groundwork had been laid, so we were prepared to make a vaccine against a pandemic agent. A lot of focus on influenza, a new novel influenza virus in our preparation, but work was also done with coronaviruses because of SARS-1, which you all remember happened about 19, 20 years ago. So it was all prepared. So people had vaccines ready to go a year ago. We actually started giving vaccines and trials a year ago. So we actually have a year of experience with these vaccines in a small number of people, and we've not seen any problems in those early people. And as Dr. Soufleris said, historically things happen in the first 6 weeks. Another thing that speeds it up is once you vaccinate people and you give another group of people a placebo, you need to have some exposure to know, does it work? You can't just do blood tests and look for antibodies. To really know if it works, you got to have people exposed. So the world complied with the need there by producing hundreds of millions of cases beginning in the late summer and fall. So we had a lot of exposure, and that sped up the time for us to see how people were responding to the vaccine. And as has been pointed out, 95% of the time, the people that had one of those two vaccines, Moderna or Pfizer, did not get infected or get sick, did not get infected, and none of them really got sick. And so we're able to speed up the time because we had so many cases that we had very intense exposure all around the world, and particularly in the United States. So no corners were cut whatsoever. And it's a part of our specialty to look at that whole vaccine development process. And we followed that closely last year. And across the board, infectious disease specialists across America are very comfortable with how that process was done. And we feel very safe. And there's been universal acceptance and taking of the immunization among us. So I have a great deal of self-preservation. I wouldn't have taken the vaccine if I didn't feel very, very comfortable. I wouldn't recommend it for others unless I felt very, very comfortable. And I did. And I took the vaccine in the first chance I got in December.
Very good. I've had mine as well, and so excited about it.
Yeah.
I'll say to our audience, if you have questions, if we haven't answered your question, go ahead and submit that with the Q&A function. And while you're typing your questions, I'll just throw this out to the doctors. We've covered a lot of ground here already today. What are the common questions that you've been asked that we haven't touched on yet?
I hear stuff from across the board. I mean, I had a discussion with a longtime patient of mine this morning, and he's seen all sorts of information on the internet, and he's concerned about putting a foreign substance into his body. So, I mean, these vaccines are infinitely sort of better tested and scrutinized and watched than cigarettes. He doesn't smoke anymore, but he used to smoke. So much more so much safer than that. They're sort of scrutinized more than food. And I don't want to impinge on the safety of our food. I think it's great in America. We also have a great system for that. But these vaccines are just as natural as a lot of the stuff that we eat every day, and their safety has been monitored much more carefully. So that's not a good reason to not get the vaccine. And as we said, it's very, very safe. The virus is quite natural. So if you let that very natural thing into your body, it could kill you. There's a significant chance of that. So I also hear, sort of fatalism in people saying, well, I'll just say it. Some people say, I trust in the Lord that he will protect me. So, and I admire that sentiment. I'm a person of faith myself, but I believe in our major, certainly in our major faiths, in our population here, I think it's pretty universal that we're expected to do our part. We don't just, we don't drive down the highway at 90 miles an hour without a seatbelt and say the Lord's going to protect me. I mean, that's challenging the Lord, and that's wrong. I mean, the Lord, there's lots of scripture from many faith backgrounds indicating that we're supposed to do our part to take care of ourselves. Getting this vaccination is taking care of yourself to protect yourself against a very dangerous thing that is widely prevalent in the world today. So those are just a couple of the things that have come up in discussions with patients.
Yeah, and and I think, as Dr. Anderson says, the virus unfortunately is a very natural thing. And if we look, where's this going to end? How's it going to end? I think really, if we look at things, you're either going to get a vaccine and potentially boosters, get COVID, or live as a hermit. And I think everything we do daily is a risk benefit. And I'm hoping that with this discussion, we try and allay some of the fears. The risk of the vaccine is, very, very low. The risk of the virus, it's a bad virus. I think people say, well, my chance of dying, I'm sort of young, the chance of dying. Well, yeah, I mean, it's certainly age dependent. Those over 65 are much more likely to die, but there can be, it could certainly make you sick and not kill you, end up on a ventilator. You could have a sort of mild case, but then end up with some of these symptoms of long COVID. And long COVID occurs in about 30% of people in some of the studies now. And even some of the younger children, I've heard of several soccer players who have been, on the soccer team, they get COVID, they didn't have a bad case, and then can't participate in soccer because they don't have the wind for it, And so the vaccines look to be very safe, very effective. It's a coin flip, a crapshoot, whatever you want to call it, if you get the virus. And for me, it's a no-brainer, but I hope that if any other questions are out there, we can help to try and allay people's fears.
Absolutely. Well, speaking of questions, we do have some that have come in now. One question is, what are your thoughts on employers requiring vaccine?
Well, that could be difficult. There could be some difficult legal issues because when a virus is under emergency approval, and I know I noticed another question about approval. Approval for new drugs and vaccines is a very long and arduous process in the FDA, but when there's an acute need, and we have a history of doing this in this country with both vaccines and drugs, when there's a need where people are dying and we need something now, they do an expedited review. It's still very carefully done. They spend a lot of they actually spend a lot of time. They just instead of sort of slowly analyzing it, I mean, people are working like 20 hours a day scrutinizing this material, and that's what they did in December and January to approve the Pfizer and the Moderna vaccines as an emergency approval. But it's still, they will still go through the long formal process and get official FDA full non-emergent approval eventually. Until then, I think there's possibly some legal issues in requiring it. I know for that reason, we can't require it for people who work in the hospital as we do the influenza vaccine. Even the United States military can't require it. And I can tell you, they require a lot of stuff when you're on active duty. Whether an independent employer could do that because of the high risk that places their other workers and personnel in, I'm just not sure. That might be a question for a lawyer. I mean, I would love to require it in certain areas, including healthcare, but I don't know that we can do that officially until it gets a full approval.
Great, great. Another question that has come up is if people choose not to be vaccinated, doesn't that mostly just affect that specific person versus people around them who are already vaccinated?
Well, it certainly affects the person and their decision, but it's also all their contacts. You know, the people who are vaccinated are protected. No vaccine is 100% effective, but the data do look good as far as how protective these are. But again, it's somewhat societal as well. If we have this virus circulating amongst in the community, we don't reach that quote herd immunity. We can't shut down the virus, and in the long run, it just propagates. And as we spoke earlier, things like the variants become worse, and so it's it may be an individual choice, but it has ramifications for the community as well.
Yeah, I agree. I mean, I view it as a civic, maybe not a civic duty, but a civic thing, something that you're doing for not just yourself, but for everybody around you. You're helping to protect everybody. You're making it not likely that you're going to transmit it to other people. As I alluded to earlier, people who are immune suppressed might not react as well to the vaccine and get the full protection. So it makes it even more important that all the people around them get vaccinated so they don't get exposed. So all these things, really taking the vaccine, wearing a mask, I don't view it as something that we're impinging on your freedom with. It's something that we're asking you to do for your fellow human beings, and in this country for your fellow Americans. I mean, I think we have a great history in this country of looking out for each other and doing things for each other. And this is what that taking the vaccine, wearing a mask, that's what it's about. This is like going and volunteering to go fight in World War II, or when you can't go fight, staying at home and going to work as maybe as a woman in an industry that's never had women working before. Was it Rosie the Riveter planting a victory garden, buying war bonds? I mean, our country achieved stunning results in the early 1940s against a common enemy. It's time for us to do that again as a country. And if you're not getting vaccinated or you're refusing to wear a mask, you're not doing your part.
Well, thank you for that response. Another question is, there's been a group apparently that has said that the vaccines could help the virus mutate more. So what is your thought on those that are putting that theory out there?
Well,
Very much.
Basically,
yeah, go ahead, Adam.
Well, all I was going to say is basically if you get immunized and it prevents you from getting the virus, the mutations actually occur if you get infected. And like as we said, billions and trillions of viral particles are within your body, and when you have that number, then you get mutants and you end up with variants. So really, getting vaccinated will prevent you from, propagating mutations, at least in you and anybody who gets vaccinated. That's one less person that will have these trillions of viral particles that can mutate.
Yeah, that's just, I mean, that's historically such a vanishingly rare thing that it almost seems silly to worry about it. And just think of the volume here. So we've been using the vaccine for a year now. Vaccines are sometimes for at least a year. We've given almost 740 million doses of the vaccine around the world, and nothing like that's been seen. So that I don't consider that a cause of worry at all.
Absolutely. And then one other question is that we've seen the vaccine rollout be so much more aggressive in this country than in other countries. Do you have thoughts on why it may be a little slower in other countries?
Well, I mean, I think we've got great manufacturing capability here for vaccines. As Dr. Soufleris said earlier, we put a lot of money into this effort beginning last year in 2020. The federal government poured a lot of money into this vaccine effort. What was it, Operation Warp Speed?
Yes.
We made a commitment as a country for this vaccine, and that's happened, and that has been supported, and it's been done by people from across the political spectrum. This shouldn't, this shouldn't be a political issue. This is something we've done a great job of, and very admirable. It wasn't a certain thing, even with the size of our country and our manufacturing capability. It wasn't a given it was going to happen, but it has.
And there is one country that I think should be looked at. An experiment is happening right now in Israel. Israel has now vaccinated about 98%, or they have seropositivity at 98%. And basically, they are approaching a pre-COVID or post-COVID world. I think things are opening up there, and it'll be interesting to see. So, I certainly agree with all of Dr. Anderson's comments, but we also see that there are a few countries, and Israel obviously is a lot smaller and had a system in place, but it'll be interesting to see, because I think that's one of the real benefits from a vaccine. Let's get on with our lives. We all want to do it, and we can do that faster the more of us are vaccinated.
Great. And one last question, because we're just about at time. So how long is it going to take us to get to herd immunity?
Depends on how many people get those arms out there to get the vaccine. We feel like it's probably at least 70% of the population needs to be immune. I think we're at about 23% of the population who's been fully vaccinated. So we got a ways to go. There are probably some people that haven't gotten who had COVID and have not gotten vaccinated, and probably are less susceptible. As we said earlier, we still recommend the vaccine, but they probably have some. I think that's going to contribute to it. That's going to make that number is probably people that are pretty well protected and unlikely to get it and pass it on is probably significantly higher than 23%. But unfortunately, it's not. Even with that, we're not close to 70 yet. We got to get a lot more people vaccinated.
Excellent.
And I think Dr. Anderson's point of sort of civic duty, I really, civic duty, I would agree. And I think if we want to reach herd immunity, we all have to pitch in. It's not going to happen otherwise. And I would just really encourage people to get the vaccine. Like Dr. Anderson, at my first opportunity, I got it. And it was actually, it felt good. All of a sudden, wow, a triumph of science. And now, feel much, much better and able to, not worry about passing it on to my mother-in-law who's got cancer and, other family members. So I think it behooves each of us to get that vaccine.
I felt the same way. So this has been excellent. Is there any final word that each of you want to give as we close out?
I just appeal to people to do this for their family members, for their neighbors, to do it for also the economic health of our country. We've suffered some grievous damage to our country. Certain jobs have been lost. Certain types of jobs have almost been eliminated because of the high risk associated with activities which those jobs are involved. A lot of businesses have closed. Great harm has come to people economically, and that is not insignificant. That's a part of the suffering of this pandemic, And to me, it's even more reason to try to get it under control faster so that we can get on with our lives. That's going to improve our mental and emotional health. We're going to be able to go out there and support those businesses, restaurants, hotels, bars, entertainment, things that have been closed down, airlines. We can begin to travel again and support our family, our friends, our neighbors, our community in that way as well. And the faster we get this good immunity with the vaccination, the faster we can do those good things for our communities.
Well, thank you. This has really been excellent. Really appreciate all of the information you've put out there and certainly sharing the personal aspects. So thank you so much. Thank you. Thank you.
Thank you.
Have a great day, everybody.